So I'm gathering all my supplies. I'm going to hand sanitize before I come in the room. All right, checking the chart for any baseline factors that could influence my assessment. All right, knock, knock, knock. Hi, my name is Laura. I'll be your nurse today, okay? Can I get your full name and date of birth? All right, good. I'm going to raise your bed up for me, okay? I'm going to check that against your wristband. All right, I see you have allergies here. Can you tell me what those are? Okay. Are you in pain today? No? All right. Well, just to let you know, we are going to do an assessment today. It's going to take about 20 minutes, but we will get it done. And if you have any questions in the meantime or want to stop me throughout, just let me know and we can stop and answer any questions, okay? Anytime you feel discomfort or anything like that, let me know. I'm going to go ahead and shut the door. All right. Do you need to use the restroom before we begin? Yeah? All right. We can go ahead and go. All right. On your back, I'll shut the door. And just to let you know, while I was watching you walk back and forth, your gait was good. It was steady. I saw no signs and symptoms of distress. Are you having any anxiety today? No? Okay. No body odor, hair odor. Hygiene looks good. You bathe regularly? Okay. Hair distribution, quantity looks good. Hair texture looks good. No signs and symptoms of diaphoresis or pallor or cyanosis. Everything else looks good other than your chief complaint. Is there any other issues today or problems that you would like to talk about? Okay. Sexual development looks good for a 30-year-old female. Your posture and your stature look good. We took your height and weight when we did triage upon admission. It's your appropriate height and weight for your age. And we also took your vital signs there, so I'll let you know what those are. You were a little bit feverish. You had 100.1 fever. Did you eat or drink anything within the last 30 minutes? Yeah. Okay, well, that could have influenced it. Your blood pressure was 88/50. That's a little bit low, but like you said, you're athletic, you're a runner, so that probably plays a big role in that. Your pulse, it was a little low in the 50, and then your apical pulse was 120, so it's a little bit of a difference there. But as we do our assessment and our cardiac assessment, we can see if there's any other factors that could play a role in that. Your respirations were 24, so it's on the high side, but that could just be from the walk-in or, anxiety or whatever that may be. So if you're ready, we'll go ahead and get started, okay? Right. Just while I'm getting my gloves on, do you have any past medical history that's pertinent to this visit or anything that you want to talk to the doctor about? I can notate. Okay. Any surgeries in the past? Any family history? Okay. Right. And do you smoke or use alcohol or recreational drugs? No? Perfect. All right, so we're going to start with your head. First, I'm just going to inspect your head, looking for any abnormalities or any bruising, symmetry, size. Everything looks good, proportionate to body. So I'm going to put my hands on you. Just palpating your scalp for tenderness, looking for any lice, looking at your hair texture, your quantity, distribution. Everything looks good. No open sores or abrasions or anything like that. Any tenderness? No? Good. I'm going to take a look at the back of the neck. All right. Looks good. Any tenderness upon palpation? No? All right. Good. And then while I'm right here, I'm just looking at the front of your neck. I'm going to go ahead and palpate your lymph nodes. Let me know if you have any tenderness or pain. All right. Trachea is midline. No jugular vein distension that I can see. All right. I'm just going to go ahead and feel your neck, okay? Just checking for tracheal deviation and feeling for any JVD, jugular vein distension. While I'm here, do you have a history of any thyroid, hypothyroidism, or hyperthyroidism, or does it run in your family? No? Great. So I'm going to put pressure right here if you could swallow for me. All right. Looks good there. I'm going to go ahead and check your carotid on both sides one at a time while I'm checking the radial pulse. All right. it's a 3+. I'm going to check the other side. And that's also 3+ and equal. All right, can you go ahead and touch your chin to your chest for me? Good. And each ear to each shoulder, left to right. All right, good. So now I'm just going to inspect your face. I'm just looking for any bruises, any tenderness that was noted when we touch, any edema, any bruises. No trauma to the face noted, so I'm going to go and put my hands on you. I'm going to palpate your sinuses, applying pressure up and looks good there. All right. Good. Any tenderness or pain? Good. All right, I'm going to take a look at your ears. All right, inspecting for any type of cerumen, which is earwax, any drainage, any bruising. Check behind the ear for scars. Looks good. I'm going to go ahead and take a look. I'm going to pull the ear up and back. Taking a look in at your tympanic membrane and any bony prominences. No excessive drainage, no open sores that I can see of. Tympanic membrane looks intact. All right, and I would do that on both sides. I'm also going to go ahead and do a couple tests on you. First, we're going to do the whisper test, then the Weber, and then the Rhine. The whisper test, I'm going to say a couple words on each ear, and you're going to let me know what you can hear. Repeat those words back to me. All right. You repeated those words good. We did that on the right and the left side. This is a conduction fork. First, we're going to do the Weber test. I'm going to strike it and place it in the center of your head, and you're going to let me know if you feel that on either side. Feel that? Any more or less on the right side or the left side? No? Okay, good. So now we're going to do the Rhine test. So what I'm going to do is I'm going to put this end on your mastoid process for 2 to 3 seconds, and then I'm going to release it, and then I'm going to put this part right about 1 to 2 inches from your external ear and see if you can hear that. And let me know if you can hear it more or less on the right side or the left side, or if it's equal, okay? All right, and we're going to do that on both sides. All right, so we'll put that up. Now I'm going to go to your eyes, just inspecting external and internal features. No lid lag noted. Your sclera, your conjunctiva looks clear. No drainage. Do you wear glasses or contacts? No? Okay, and when was your last vision appointment? Last week? Great. So I'm just going to go ahead and take a look at your eyes. We're going to do what's called PERLA. It's pupils equal, round, and reactive to light and accommodation. So I'm going to shine this light in your eye. If you could just look straight ahead for me, okay? Good. Good. All right, so now we're going to do what's called accommodation. So I'm going to put my pen light right here. If you could just look at the pen light, okay? I'm going to bring it closer to your face and then back. And one more time. All right, and now we're going to do some muscle function tests. So I just want you to, without moving your face or your head, just your eyes, I want you to follow my pen, okay? Good. Last one. Great. Just looking at your external nose area, symmetry looks good. It's proportionate to your face. I'm going to take a look with my pen light, okay? Just checking for a deviated septum, any excessive drainage, any open sores. Your nose looks good. Do you have a history of nosebleeds? No? Good. So I'm going to move to your mouth. External looks good. Smile is symmetrical. Like I said earlier, the speech is clear. So now I'm going to take a look inside your mouth, okay? Do you have a history of wearing dentures or any dental caries, or do you frequently visit the dentist? Okay, I'm going to take a look. Mucous membrane is moist and pink. I don't see any obvious dental caries. All right, can you say ah? Uvula moves up and down. All right. And I'm just going to ask you a couple questions real quick. You told me your name and your date of birth. Can you tell me where you are? Good. Can you tell me why you're here? Good. And who's the president? Good. So alert and oriented times 4. So the head and the neck is done. We're going to move down to your chest and your abdomen next, okay? The door is shut, so we're going to move up your gown. I'll cover up your bottom half, but we're going to have the top part exposed, okay? Right. So first I'm just going to inspect the chest. While I'm here and your mouth breathing, I'm going to go ahead and listen for any abnormal sounds. No abnormal sounds noted. And just so we've got lung sounds down before I get started, you've got 3 different types. You've got bronchial, bronchiovesicular, and vesicular. Bronchial is heard up in the tracheal area. It's more of a tubular, hollow sound. It's loud and very high-pitched. Usually lasts longer on expiratory. And then right down below that, you've got your bronchiovesicular, which is to the left and the right of your sternum. And that's about middle lobes. It's a tubular quality, moderate intensity, kind of a blowing sound. And then below that, you have your vesicular lung sounds. And those are going to be kind of a soft, rustling sound. And those are all normal to be heard. So we'll go ahead and oscillatate. I'll oscillatate 4 places, anterior, 3 on the right, and 2 on the left, okay? Need my stethoscope. Breathe in and out. Breathe in and out. In and out. In and out. Got 3 on the right. In and out. Deep breath in and out. And last one. And the left side, breathe in and out. And one more. Good. All right, so I'm just going to palpate your chest, just feeling for any pulsations, any tenderness, crepitus, any soreness, okay? So let me know if anything hurts. All right. Can you take a deep breath in and out? All right, just checking for lung expansion, and my thumbs do move up and down at the same time. So that's good. I'm going to go ahead and, if you can say 99 for me every time I place my hands on your chest, okay? Say 99. Again, again, and again. Good. I'm going to go ahead and percuss. And 3 on the right. And 2 on the left. Good. Lung sounds are clear. Okay. I'm going to go ahead and we're going to listen to the back side, okay? All right, sit up for me. Thank you. I'm just going to inspect the back, looking for any type of trauma, abrasions, open sores, anything of that order, but everything looks intact. Bottom looks good, no pressure ulcers noted there. So I'm going to go ahead and listen to your lungs from the back side, okay? All right, breathe in and out. Again. Breathe in, breathe out, breathe in, breathe out, and breathe in, breathe out. And last time. Good. Lung sounds are clear in all lobes, anterior and posterior. All right. Can you say 99? Again, again, again. 99. And last time. Good job. And now we're going to go ahead and just kind of palpate and just feel for any tenderness or crepitus, any deformities there. And I'm going to percuss. All right, looks good there. We're going to go ahead and lay back. Well, before we do that, real quick, take 1 deep breath in and 1 deep breath out. All right, and my thumbs moved up and down equally. We've got good lung expansion there. Whew. All right, and before I do your chest, real quick, can you blow your nose for me? All right, and breathe out. And one more time. Good job. All right, now we're going to go to your chest. I've got 5 places I'm going to listen to here. I've got aortic on the right side of the upper sternum. Then I've got pulmonic on the left side of the sternum, and the rest follow below it. Erb's point, tricuspid, and then mitral. Good. And we already listened to your apical pulse and we got your vital signs, so that was good. So we're going to move right along to your abdomen. When was your last bowel movement? Okay, this morning. And do you remember the color, consistency, texture? Okay. And how frequently do you use the bathroom? Good. And when was your last oral intake, food or drink? Okay. All right, so your nutrition status is good. Your diet appears appropriate. Do you have a history of hemorrhoids, STDs, STIs, rashes, foul-smelling urine, any pain on discharge? All right, good. Well, I'm just going to inspect your abdomen, just looking for pulsations, checking your epigastric area, looking for any visible hernias. Everything looks good. No abrasions, no open sores. So before I get started with putting my hands on you and listening, I'm going to go ahead and get you to flex your knees and kind of bend your knees up for me a little bit, make it a little bit more comfortable. And I'm going to go ahead and listen. I'm going to start in the right lower quadrant. I'll listen for 1 full minute if I hear bowel sounds. If I don't hear bowel sounds, I'll listen for 5 minutes. I'll go right lower, right upper, left upper, and left lower. Good. I'll go ahead and keep these on. And I'll do this with the bell of my stethoscope. At the very top, I'm going to listen to aortic, all right, and then your right and left just below that are your renal areas I'm listening to. And that's right and left side. Just below that is your iliac, right and left side, and then femoral, right and left side. All right, no pulsations or no abnormalities noted there. So I'm going to go ahead and percuss your abdomen. Good. No tenderness, and I'm also going to palpate. After each palpation, I'm going to need you to cough. If anything is tender, let me know. Start in the right lower, right upper, left lower. And you coughed after each palpation. That was good. No rigidity, distension, no guarding of a painful part, so that's good. I'm going to go ahead and put your gown back down. And we're going to go to your upper and lower extremities, okay? So first I'm just going to inspect your upper extremities, just looking at tone, temperature, hair distribution. All looks good. Any pain with your upper or lower extremities? No? Okay. Well, I'm just going to palpate your upper and lower extremities, just feeling for any crepitus, any deformities. No pain? Good. While I'm up here, I'm going to check your pulses. Brachial artery, equally at the same time. All right, and those are 3+, equal bilateral, and then I'll go to your radial. Equal bilateral, 3+. Okay, and go to range of motion. Can you lift your arms above your head and out? Bend your elbows, back down. Good. All right, while we're right here, I'm going to do some strength tests. Can you push against my hands? Good. And pull away. Good. And check your cap refill in both hands, all fingers. Good. They're less than 3. So we're going to do an Allen's test. We would normally do it on both extremities, but for this purpose, we're going to do it on one. So I'm going to include the ulnar and radial artery. If you could make a fist. Hold it for 10 to 15 seconds until the hand becomes pale and kind of cool. All right. Open your fist. All right. Good. And I'll release pressure on the radial artery. Color should come back within 10 to 15 seconds, which it does. So you've got good perfusion to your hands. All right, and then reflexes. All right, we're going to do the brachial, the triceps, and the brachioradialis. Okay, that's the triceps. Brachial, I'll do it over my hand. And brachioradialis, I'll do it over my hand. We'll do that on both sides. All right, upper extremities are good. We'll move to your lower extremities, okay? So just inspecting your legs, looking for symmetry, hair distribution. Everything looks good there. I'm just going to put that over there. All right, Good. I'm going to palpate. Checking for any pulsations, any tenderness, any crepitus, any deformities, no open sores, any pain. Good. I'm going to go ahead and check pulses. We've got femoral, equal bilateral and 3+. Popliteal, equal bilateral 3+. Dorsalis pedis, equal bilateral 3+. And anterior tibialis, equal bilateral 3+. Good. I'm going to do your cap refill while I'm here. All toes, both feet. Good. They're less than 3. We're going to do some range of motion real quick, okay? Just show me what you can do on your own. Can you bend your knees to your chest? Good. And back down. Good. And I also saw you walk in the bathroom, so your range of motion is great. Right. While I'm here, we'll do some reflexes. I'll have you sit on the side of the bed to do this. It'll be a lot easier for you, and we can assess it better, but we'll do... We'll start with your plantar reflexes, and that way your toes will curl in. Good. And then your Achilles, we're going to hit right behind here. I'll do it over my hand. Both sides. And your patella reflexes. And that'll be where your legs are dangling off the bed. Okay. Good. We've got our pulses, we got that. I'm going to go ahead and roll you so I can check the back, okay? Alright. Inspecting the back for any bruises, lacerations, abrasions. None noted, no crepitus, no pressure ulcers noted. So we look good there. Alright, I'm going to get you covered up. And I will let you go back to resting. How was that? Not too bad, huh? Good. Alright. No pain after the assessment? Good. Alright, well, side rails are up. Bed's in the lowest position. Your call light's right here. And remember, my name's Laura. If you need anything, just call me and let me know, okay? Right. Get all my supplies. Alright, I'll be right outside.